What's up everybody, Dr. Rossi, shrinksandSneakers.com. So in this video, I'm going to continue with my theme of psychotropic drug combinations with interesting names or interesting combinations. So this is going to be the story of two medications, Zoloft and Wellbutrin, to create the medication combination Welloft. So we're going to go ahead and crack into the video. I'm going to discuss each one individually and what is interesting about their mechanism of action. And in the end, I'll kind of wrap it all up with why I think this particular drug combination might be beneficial for treating patients with depression. On my screen here that I brought up the basic information on sertraline, also known, of course, as Zoloft. It's the part that gives us the Welloft portion of the name. So Zoloft is an older medication, very commonly prescribed medication, both in psychiatry as well as in primary care for treating a lot of different disorders. So if we look here, you can see, the brand name, of course, is Zoloft, and it is available now in generic form. And it's an SSRI. And I've talked about these things before in the past, but that's a selective serotonin reuptake inhibitor. It's commonly prescribed for things like major depressive disorder, obsessive compulsive disorder, panic disorder, PTSD, PMDD, as well as social phobia. And if we look here at the mechanism of action, you can see that it boosts the neurotransmitter serotonin and blocks the reuptake pump. So hence the reuptake inhibitor concept of these SSRI drugs in general. One of the more interesting points about sertraline that I want to direct your attention to is that it has the ability to block dopamine reuptake pump. So what makes that interesting is not only are you getting the effects of, enhanced serotonin transmission, you're also getting some increased dopamine, which is different than many of the other SSRIs. So that's an interesting kind of caveat with sertraline medications. The other thing to think about is the dosing of this medication. So generally anywhere in the range of, I'd say 25 to 200 milligrams a day. And that's more so with the elderly and younger patients. You might start at 25 milligrams a day just to make sure that they tolerate this medication appropriately. The next thing to say is the 200 milligram dose is not an absolute. Sometimes we go higher than 200 milligrams in things like OCD, which generally require much higher doses of these medications, but 50 to 200 milligrams is a reasonable dose range. So this talks more about, how to dose it, some of the general advice about that. Some of the tests you have to do, you'll notice there's no test necessarily for healthy individuals. It's not habit forming, so it's not like a benzodiazepine that you have to worry about. And then, of course, the side effects are kind of the typical things that we talk about with a lot of these medications, which would be GI distress and nausea, dry mouth, diarrhea, constipation, sexual side effects, particularly for men, delayed ejaculation, erectile dysfunction, etc., and reduced sexual desire for women, along with anorgasmia. So these are some things that you definitely worry about. SIADH, we worry about a little more in the elderly patients, and in some cases, because serotonin is involved with platelets and platelet aggregation, you have to worry about bleeding in some rare cases. So just going back, though, to the idea of why sertraline is a good medication, again, it's a typical antidepressant medication, selective serotonin reuptake inhibitor, and it has this added benefit of also blocking the dopamine reuptake pump. So sertraline has a couple of different mechanisms by which it may be helping to improve a patient's depression. So in the next clip, we're going to talk about Wellbutrin or Bupropion, and we're going to see what type of mechanism that is and why, again, the combination of these medications might be beneficial. The medication in this combination is Bupropion, also known as Wellbutrin, and it comes in a couple different forms. There's a sustained release, an extended release, and then there's a couple of different names associated with it, probably the most common one being Zyban, because this medication, that's the way it's branded for smoking cessation. But I really want to turn our attention to the mechanism of action as well as the class of the drug, because I think that's where we start to see what the real reality of this is and why, again, this combination of sertraline and bupropion might be beneficial. So this is what's called a norepinephrine dopamine reuptake inhibitor, and it works as an antidepressant and for smoking cessation. So if we look at the reasons that this medication is usually prescribed, it would be prescribed for things like major depressive disorder, seasonal affective disorder, and nicotine addiction. The mechanism of action, bupropion works by boosting neurotransmitters, norepinephrine and dopamine. So if we go back and just think for a second about sertraline, now we have serotonin and dopamine with the sertraline, and we have norepinephrine and dopamine with Wellbutrin or bupropion. So it's going to block the norepinephrine reuptake pump, and this is beneficial because there's not really many of those pumps in the frontal cortex, so this can lead to enhancing dopamine transmission in the frontal cortex, which we think may be related to the antidepressant effects as well. So similar to what we talked about with the serotonin, selective serotonin reuptake inhibitor, similar type of thing going on, only it's working now on different neurotransmitters, specifically norepinephrine or noradrenaline and dopamine. Now the dosing, there's a bunch of different forms. Again, it depends on which one you're using, right? And so you can see here that there's a bunch of different doses. Generally speaking, if I can use it, I will use the XL or extended release formulation. And the reason I like extended release is this. It allows for less dosing, so once daily dosing. A lot of people cannot remember to take medication. Even myself would have a difficult time if I had to take a medication, 2 to 3 times a day. It's very easy for people to remember to take then if it's once a day. And because the extended release does not result in the huge bump in serum levels of the drug, which is often related to side effects. It's often how the rate of rise of the drug in your blood that causes the side effects, not so much the amount per se in the dose. So what you want to do with the extended release, again, is it provides a more sustained level in your blood than the immediate release or sustained release. So that's why I prefer that if I can use it. Now, there's a bunch of different information here. Probably the main thing you want to look out for with these patients is if somebody has had a history of seizure, because this medication at higher doses, specifically 450 milligrams and above, you start to see increased risk of seizures in people who are susceptible to them. Or if the person, of course, is abusing the medication in some way, such as cracking them open, snorting them, crushing them up, etc. Some of the notable side effects, just to go over, these are all almost the same in most cases. Again, the GI distress, dry mouth, nausea, constipation, the other stuff like insomnia, headache, agitation, anxiety. These medications work both for anxiety but can also cause anxiety, so it's something to remember. What I like about this medication is that it's weight neutral, right? And weight loss or anorexia is one of the actual side effects. So a lot of our medications cause weight gain, so this is a good medication to help kind of balance that out. Or if somebody's concerned about weight gain, this may be your go-to medication to start with in some cases. Another case where this may be a medication you start with is for somebody who's very concerned about sexual side effects. We know that this is the best medication if you see the answer on your board exam or your USMLE exam, and someone's having sexual side effects or is having sexual side effects from a medication, doesn't want to have them, switch them to bupropion. If somebody is worried about sexual side effects but they're depressed, you might want to start with bupropion. So that's how we kind of think about this. And yeah, it can be difficult. So I'm going to talk in the next clip a little bit about, this combination now. And now that we've gone over both of the medications individually, we can kind of see where this is going. The idea that the more neurotransmitters and the more various types of neurotransmitters we decide to boost, the better off the response is going to be for the patient with depression. And I'll explain a little bit about what I mean.
All right, guys, so let's wrap up this video on the medication combination Welloft, and I'll tell you just briefly my thoughts on why I think this works and why these two medications work synergistically together. So in the one clip, we discussed sertraline or Zoloft, and we said that not only is there this serotonin reuptake inhibition, there's also dopamine reuptake inhibition, which could be increasing dopamine in the prefrontal cortex, leading to improved antidepressive effects. Now you take Wellbutrin or bupropion, and you have norepinephrine and dopamine reuptake inhibition. So essentially, if you go back to one of my previous videos where I discussed the biological basis for depression and a little bit about how these drugs came about, I had said that MAOI or MAO inhibitors
were the sort of original antidepressant in this category, right? And so with those drugs, they're irreversible, usually inhibitors, most of them, not all, irreversible inhibitors of that enzyme, which leads to an increase in all of these neurotransmitters: serotonin, norepi, dopamine. So sort of the similar concept here. The more of these neurotransmitters that we believe are involved in or have antidepressant effects and are involved in depression, the biological basis of depression, the more we're going to benefit from these drugs. So the combination of these two drugs increases actually those same neurotransmitters, be it in a different way than the MAOI, right? So a different way of increasing serotonin, norepi, and dopamine, but still kind of achieving that same general result. And if you look at other drugs, the earlier antidepressants, things like tricyclic antidepressants, they usually worked on serotonin and norepinephrine. So two of the three neurotransmitters that we feel are strongly related to the neurobiological basis of depression. So when you combine this all together, essentially the more of these neurotransmitters that we are able to increase and alter in the brain, the better the antidepressant effect, at least theoretically. Because I've talked about MAOIs and I said that, I think those are actually underutilized, underrated medications. Although they have a lot of side effects and potential harm, they're also very, very beneficial for depression. So that wraps the video. If this is helpful to you guys, please like and subscribe to the channel, and we'll continue to create content on the various psychotropic drugs.